Welcome to the 10 Times Healthier podcast, where Dr. Mura interviews Dr. Jennifer Taylor, a lifestyle medicine expert. Dr. Taylor emphasizes the impact of simple, consistent changes in nutrition, stress management, and sleep on overall well-being. She argues that striving for perfection is less effective than making small, realistic adjustments in daily habits. Dr. Taylor suggests easy tips like using lemon instead of salt and understanding intrinsic motivators for effective habit changes. She discusses overcoming challenges like maintaining health on a budget and prioritizing self-care despite busy schedules. This episode is perfect for those looking to redefine their health journey through achievable and meaningful lifestyle changes. Tune in to learn how small steps can empower you to take control of your health and well-being.
Okay, Jen, what a lovely afternoon. We've been trying to meet up, but of course life has been busy, and I'm so glad that we happen to come here in East London, and we can be able to meet you. I know it's very short, actually. Still, we have a lot of things to do, but we really thank you for.
It's very special to meet you both in person. So really.
Yeah. And actually, before we're just going to have our discussion, talking about, of course, our experience in lifestyle medicine, and how actually we can use it to help patients and the practicality of it. But before we go into that, I remember we just the first time we met was actually before when you were specializing into lifestyle medicine. And the communication that we had, it's lovely to meet it, because that's the really person that we are speaking to. And I want the audience to know how lovely you are and your passion in lifestyle medicine.
Thank you, Ernest.
So
you helped me so much by helping me with preparing for the exam. So
you're so kind.
Yeah, I'll never forget that kindness. So thank you.
Yeah. So before we go into it, if you can tell our audience who you are and what your medical background, and what actually inspired your passion in lifestyle medicine.
Sure. Yeah. So I'm Jennifer Bruntrop Taylor. I'm a family medicine or GP here in East London,
right?
With a passion for lifestyle medicine. So my interest in medicine was way back when my sister was actually, I grew up with a sister with type 1 diabetes. And I always just I prayed for a cure for for diabetes. And as we know, we can't cure type 1 diabetes, but as we've learned with the power of lifestyle medicine, we can prevent and treat and even reverse a lot of type 2 diabetes.
Of course.
And so I think my passion in lifestyle medicine actually came very early on, although it wasn't yet known as lifestyle medicine. I went to UCT Medical School from 1991, graduated in 1996, did my internship at Groote and then...
very big hospital.
Yes, and then went into primary health care because I always loved looking after the walking wounded, even though, a lot of our training and teaching was in a tertiary hospital where people were inpatients. I had a growing interest in outpatient care. And but I very rapidly discovered that my tool set wasn't equipped enough to truly help people. And also those 10-minute consultations often it was just difficult to really even establish a good rapport, a healing relationship with my patients. So I kept searching and seeking for other answers, for other ways to truly help people, which is why I went into medicine in the first place. And it was sort of an evolution, because lifestyle medicine actually only became known to me, I think, in 2017. And I kept researching and looking, and then during COVID, I think I got in touch with you, and I discovered that you had done the board certification exam in lifestyle medicine, and it just resonated with me so well, and it gave me all the answers and the tools that I'd been searching for most of my career. Since qualifying, I've been practicing lifestyle as medicine here in East London, and I've never looked back. Love it.
That's an interesting story. It's amazing how many doctors, most of the doctors, they go to medical school either because of their relatives or their mom or their,
Yes.
someone in the family that has
Yes.
certain, health issues. And your sister. And of interesting to note, of course, type 1 diabetes, it's more, of course, it is the lack of, the pancreatic cell that excrete the insulin.
beta cells,
That's the beta cell that we need. But having said that, type 1 diabetes, of course, now we know, talking type 2, which is insulin resistance diabetes, even type 1, they can actually have that insulin resistance, the one we inject.
Yeah.
So that it's amazing to say that even type 1 diabetes, there's still room of improvement with the lifestyle change. You can reduce the amount of insulin that you're actually using and just using almost a physiological insulin, which is amazing. So there is actually room for change even in type 1 diabetes. But I want to come back to your experience. Of course, before you certified in lifestyle medicine, you had started working as like a family physician, seeing the patients as well. So how did your practice somehow change after certifying? Was it any different how you approach patients, how you're treating them? What was the difference?
So maybe I must also just give a little bit more background. So I did practice acute GP care for many, many years. And then a great opportunity came up for me to assist our local cardiothoracic surgeon. And I think that also fueled my passion for preventative medicine and helping patients not need to end up on a cardiac theatre table. And that definitely... as I said, just fueled my passion to learn more about prevention. So after finishing the Lifestyle Medicine Board certification exam, I finally had more of a structure to approach patients, definitely assessing their level of readiness for change. I think that's almost kind of at the heart of lifestyle medicine.
True.
It really works best for someone who is ready to make certain behavior changes. And I think that's what really stands out for me with lifestyle medicine and what's changed the way I practice is it's really looking at behavior change, because it's very hard to truly help someone if they have chronic lifestyle related diseases or diseases of like hypertension, type 2 diabetes, if you don't address certain behaviors as foundational, the foundational approach to healthcare, which is encouraging people to make good daily choices, but they've got to be ready for change. So I think definitely assessing someone's readiness for change is kind of almost the way I start most of my consultations.
And I like what you're saying is very true, because when you think about it, that's the whole difference between the lifestyle medicine and conventional medicine. Because in conventional medicine, the people don't necessarily have to change. You have a certain prescription you're going to give to them, and they carry on with their lives as nothing have happened. But now, if we need a true change, I think that the challenge that we're having with our patient, the readiness of change is very key, because now it's not the doctor take this. We want the patient to be part of the whole discussion. It is actually them who change. We need just to support them. And without that readiness and assessing readiness to change, then it won't actually work.
And I think that part of the lifestyle medicine curriculum, where we learned about the pre-contemplative stage and the contemplative stage, and then the prepared, and the action and the maintenance, that really gave me like a framework to really assess where someone is at, to rather just give them motivational interviewing, or to actually actively involve them and collaborate with them to formulate a doable action plan, something that's achievable and realistic and specific. I think that really, really helped a lot.
Definitely. And I like that, because for the viewers that are listening, especially when you talk about lifestyle change, lifestyle medicine, this is not a black and white thing. It's not do it or nothing. There is a spectrum. There is a room for change. And important, often some people may think if I don't do everything, then I might as well not do anything, but that is wrong. Any small change that one makes, it's gonna, on the long run, it's gonna be actually, amount to a huge change. And
yes.
I think that's very
small
important.
changes over time.
Yeah.
So I always say to my patients, let's not strive for perfection. We don't need perfection. You don't need to get 100% to get an A. You can get 80% and still get an A.
Yeah, true.
So it's more about showing up consistently.
Definitely.
And I think that's where a lot of people battle. So it's consistency. If we can encourage consistency, doing those small changes and trying to help them to form habits, good daily habits, rather than trying to strive for perfection.
Yeah.
Because in life, unexpected things happen and challenges come. And I think if you strive for perfection, it's going to push people away and make it unachievable. So it is a spectrum, and trying to nudge people towards the more positive end of a healthy spectrum.
True. And this is where I like when you talk about one of the, of course, the pillars of lifestyle medicine. It's nutrition, talking about the whole food predominantly plant-based diet, and that is the key. And somehow, which often, I'm sure you would have been asked, is it a veganism? Is it this? And which somehow, when you put into veganism, it's like, oh no, there are certain people, certain philosophy to that, that kind of avoid everything completely. But with the lifestyle medicine, of course, yes, of course, we care for animals and other things, but primarily we are physicians, we are doctors, so we
evidence-based,
evidence-based doctors. And so it's not, there is a room for change, and we take a patient from where they are, if they are ready to change. I was actually curious on readiness of change. What comes, I was thinking all these things as we're talking about this, because the challenge that we have, evidence is there, Jenny. It's not that there is no science. The science is there. And even when you talk to the patients, they can say, oh yeah, this is true. In fact, if you remember when you're talking about hypertension, the what is this? Even our medical school, we still have the DASH diet for hypertension.
DASH.
DASH, yes.
Dietary approaches to stop hypertension.
Now, even that diet, I mean, it's important to note that I forgot his name, the guy who was on the head of the committee who came up with that diet. It's not that he didn't know that the animal protein actually has some, a direct effect on high blood pressure. But then they were trying to find certain acceptable to the community.
That's the thing.
That's where they add a little bit of fish. Yeah. Otherwise, so there is this thing is, if you remove everything, then no one is gonna eat it.
And it's about nudging people on that spectrum.
The spectrum. So, now, my question is then it comes to even the DASH diet, because people not actually doing that. How do you bring them to that? Of course, they have to be ready. But what have you seen before they become ready? How do you, not to coerce them, but how do we speak to them and show them the gravity of the disease to their own health and their family's health, so they can come to the realization, I need to change? How do you come to the readiness part?
So I think it's also important to find out what their intrinsic motivator is.
Yes.
To talk to them and say what motivates them to make changes, to improve their daily choices, so that they can prevent or treat or reverse or improve their health parameters. So I think it's a very individualized approach. So first, the readiness to change, and then to maybe share information with them. So, you collaborate with your patient, and you go through, let's say, their biomarkers, their blood results, or their cardiovascular risk factors, and you personalize it to their situation, and also to find out what their life, everything, all those pillars of life,
what their goals are in life.
Sleep, and to go through everything. Their intrinsic motivator, I think, is very key to knowing, what will encourage them to make to make the necessary changes to make better choices every day. But it is very complex because they're different cultures, they're different traditions, they're different. People have the accessibility to healthy food can be challenging for some people. There can be a lack of interest or a lack of awareness, or a lot of my patients they understand. We do this empowerment session where we teach them about adding in more whole plant foods. It's my approach to nutrition, for example. It's about adding to every meal rather and then crowding out the ultra processed foods and working together to take, let's say, their basic breakfast and how we can optimize that to adding in more whole plant foods. But it's a process, and
it is.
It's a step by step, and again it's about showing up consistently rather than striving for this perfection.
Definitely,
but I think establishing the patient's intrinsic motivator, whether it's being energetic enough to play with their grandchildren, or being able to walk their daughter down the aisle at her wedding, or whether it's just having more energy during the day, or whether it's entering a fun run and managing to run 5 kilometers. It's so individualized for each patient, and I think helping someone establish what that is already half the battle won, because then you've got their buy-in and they want this. And I think that's important.
No, that's very true. I like your answer. And also just, even our experience, we did not all start that way. And it's more your why, like trying to find something that the why. And often I do speak to the patients, and I say, look, I try to bring all the factors, not really to coerce them, but to, like you say, putting out their blood results and see how, if we don't do this, this is what is likely to happen. And we don't have to go that route if we can do small changes.
Because we are taught that fear cannot be a motivator. That's the problem. Fear is not a good motivator. It's not a lasting motivator. It's
not lasting,
So, it is important to find out what each person's individual intrinsic motivator is. So I think that's definitely part of my lifestyle consultation approach. And then empowering people. I think that's what's so important. Guide them. Help them understand the power of food as medicine, and exercise and sleep medicine and stress coping mechanisms. I remember as a newly qualified doctor just feeling so poorly equipped to know how to help someone manage their stress. I didn't have the tools in my tool set other than a pen to paper approach and prescribing a benzodiazepine or a hypnotic for sleep disorders, or there wasn't it wasn't I didn't have a good foundational approach to every presenting complaint. So that's, I think, where my training in lifestyle medicine, it truly is foundational healthcare to which you build.
Of course.
And pharmaceuticals still have a place, but my approach is, let's try the lowest effective dose. If someone needs a prescription, let's correct the foundational health as much as we can, and then build from there. And also, just coming back, but have in of course, in your experience as how you grew up, how was your family like during your childhood? Was it a very more healthy oriented type of family, or how was your growing up? So my sister and I were actually born in Germany.
Right.
So we were born in Europe. We moved here when I was still very young. My sister's 2 years older than me. And my mum was a wonderful
cook.
Home mom. She was always around. Lots of home cooking, but very different to how I eat now. It was a lot more. It was more of a kind of everything. I mean, we definitely ate animal products. Some processed things like the German sausages and things like that. So no, I didn't grow up vegetarian or but definitely always home cooked food and lots of vegetables as a side. But the knowledge just wasn't there, you know. We
yeah.
didn't know all the evidence for whole grains and legumes and all the polyphenols. And I didn't have nutritional science knowledge at that point, and neither did my mom or dad. So I would think just probably grew up very, very similar to the general population, you know. So I think the world progresses, and knowledge and research and nutritional science is just progressing every day. And there's still so much that we as scientists don't know and are still trying to prove. But I think definitely one common agreement, I think, amongst all the diet wars out there is that the more we add in whole plant foods and crowd out ultra processed foods, that's already a big step in the right direction.
Definitely. Jen, I'm going to touch on other, often when you talk about lifestyle medicine, I think I want people not to have, often we forget other pillars, or they are not often spoken. Of course, nutrition is very, very important, but also we're talking about other pillars that are very, very important. And if you can just briefly touch about them, especially when you see patient. Of course, we talk about the exercise, and there is stress management. We talk about sleep. You didn't mention sleep, social connection, substance use, and the kind of things. In a patient that you see, which of course food is already prevalent, people eat anyhow. But second to what people put in, which are the aspects of life you think, it needs to be, addressed as well?
So Ernest, that's it's very, very difficult because so I practice in the Eastern Cape, and lots of farming communities. Where definitely the mindset is definitely the animal protein is sort of the hero of the dish, and so one has to work on all of that. But from the other pillars, so exercise, sleep, stress management, substance use, it's almost very hard for me to single out one of them because they're all in different people present at different levels of significance. Definitely seeing a lot of anxiety, mood disorders, mental health, I would say, is definitely a big contributor to downstream disease at the moment. So I do like to focus a lot on stress management. And then that goes hand in hand with sleep. Often very anxious people or people with low mood, their sleep is also disrupted, which then disrupts your hunger hormones and then can affect your food choices the next day. Substance use is also another topic quite close to my heart because I do see a lot of alcohol misuse. So not necessarily abuse, but just misuse. If you look at
what would be the difference, if you may ask, misuse, abuse?
Well, I suppose the alcohol addiction or abuse is just, is where it really disrupts someone's functioning.
Of course.
And they often, we called it a regmaker, like wake up in the morning and they sort of need a drink to start their day, and there's disruption in their social life and their career or their work life or their family life, or their relationships break down with alcohol addiction as such, or abuse. Alcohol misuse is, I almost look at it more as middle lane drinkers, like people who, let's say, don't drink anything during the week, but then they have sort of a binge drink and they think, oh no, we don't drink anything during the week, and we just on a Friday have 4 or 5 units of alcohol, maybe on a Saturday too, and that's, I suppose, I classify as alcohol misuse. And substance use, and of course with vaping and smoking, vaping has made it's very much more accessible even to young children. Even primary school children can be exposed to vaping and have access to vaping. So that is one of my big concerns too, which falls under sort of substance use.
Yeah, of course,
so I try and touch on all the
on
pillars.
Those pillars,
but each individual person again is so unique in what they need to focus on.
True.
But it's very rare that one only focuses on one pillar, because they're all interrelated, which brings me back to, at med school, we very much taught in compartments. We do obs and gynae, and then we do general surgery, and then we do internal medicine, and then we do ENT and ophthalmology. But we've got to remember that we're a whole person, and we, a whole lot of different units working together as one system. And so I think lifestyle medicine is nice because it really considers the whole person and the effect of our environment on our health.
Yeah. And Jen, but it's not easy. It's hard. I just remember when I was young, my parents are telling me, even some point where when you talk about nutrition, of course we talk about the use of salt and high salt and aid effect of them. But in a community where they were growing up, there was no one using salt. So that wasn't an issue. You didn't have some salt to add or kind of things. But now we are in a society whereby everything is fast food, highly processed. Are we practical? Do you think we're practical to talk about this lifestyle medicine, or is it for certain people? Or is it for everyone? Because you have someone who's who doesn't have a choice. Probably they have they can parent where they are. They certainly really can have a good meal. If they find food, they're gonna eat whatever they can get. There's someone who does night shifts and long hours, and of course the social connection is gone. Exercise, of course, probably lifting, going up and down, whatever that could be exercise. He's very, very stressed. Is this practical for everyone, or is certain people? What can you tell that person who almost have no life? Is anything they can start doing?
I think there's always hope.
There's always hope. Yeah.
Hope is probably the most positive emotion. And I think if we give up on hope, then I really think we need to hold on to hope. And I think for each individual person, there's always got to be something that can be done to improve. Sure, I hear what you're saying, Ernest. It can be seen, lifestyle medicine can be seen as almost a privilege to the privileged. And I almost say, I want to encourage people to actually go back to our roots. And it can be something as simple as eating a potato rather than a packet chips of Doritos, or eating beans instead of eating stewing beef. But I hear what you're saying. There's such the societal gap. They're huge, contrasts. And I don't have all the answers to that. I think in certain settings it probably isn't always practical to teach lifestyle medicine, but we have to start somewhere.
Yeah, you're right.
And I think even if teaching, allowing people to understand that the ultra processed foods with all the added, the trans fats, or the oils and the sugars and the salt, can actually have an effect on our reward system.
Of course, hyper-stimulant food that end up changing,
and it can change our palate and our own perception of what sweet and salty actually is, and just teach them little things like add a squeeze of lemon juice rather than add that extra bit of salt, and try and adapt your palate to shift it in a more healthy direction. But I also think, taking opportunities, every doctor just has some knowledge of lifestyle medicine, even in a busy waiting room or discharge lounges. If there can just be some patient empowerment, if there can just be little pamphlets where maybe, we can, and that's something Salma, for example, really wants to work towards, is actually creating patient education booklets where there's an opportunity for patients sitting and waiting for their pharmaceuticals from a pharmacy, or waiting to see a doctor, that time can be spent reading a pamphlet and just empowering them with little health nuggets. Like we said, those small changes over time, and holding on to that positive emotion of hope.
Definitely.
I'd like to think that it is possible for someone to add little exercise snacks to their day.
True.
You know, whether it's doing, you know, whatever they're able to do in their physical capacity, whether it's doing leg raises while they're waiting for their rice to boil on the stove, or whatever they can manage. You know, if they can do biceps curls with a water bottle in each hand, you know, there's always something that someone can do to just improve their health.
True. I like your answer, and I think it's very true. I also always tell people is, you know, what we're doing is to communicate these messages so that at least people can know there's an option.
Yes.
You know, once you know empowering them. Once you know there is another way to look at a certain situation, you may not be able to do it right now, but you can actually start planning towards to. And so I believe what you say is very true. There is hope, and there is, even whatever circumstances that people may find themselves in, once they know, and there is a will to change, coming back to the readiness to change, there is always a way.
Absolutely.
They still have a certain form of autonomy to start doing things.
So that's what I'm passionate about, you know.
Like that, yeah.
That collaborative doctor-patient relationship, rather than that, you know, where the doctor says and the patient does.
Yeah.
To actually really empower people to help themselves. I think that self-regulation and self-monitoring, I really think that's the future of healthcare. So, you know, to really empower people to make better daily choices, to hopefully, you know, prevent downstream disease.
Definitely, And I just want the viewers to know, while we're talking about this, I personally am not 100% doing things right as we should. Often, especially the doctors, we are worse in certain areas.
Absolutely.
I mean, working long hours. I mean, some even have, if you do calls, it's very, very sleep deprivation.
We neglect self-care, right?
Self-care, you know.
We neglect self-care often. So absolutely. And again, it's not striving for perfection, but trying what we can. And as healthcare professionals, I think a lot of us are real fixers. You know, we like to help everyone. We don't often feel comfortable saying no, or setting boundaries, or sticking to our boundaries. We just want to help everyone. And that's why we entered the profession. And so sometimes self-care can be neglected. And, you know, we can suffer from compassion burnout. We need to remember to apply these pillars of lifestyle medicine
definitely.
to our own life first. And I think that's what I love about, you know, when you're flying and you get those safety talks about, you know, the oxygen masks coming down and always putting the mask on yourself first and then helping others. And
we often don't do that,
No, it's about a reminder of self-care. And you know, every now and then checking in with your own nutrition. And, you know, are you physically active enough? And, you know, what are your stress coping mechanisms like? And, you know, how can you improve your sleep? You know, all those things.
Definitely. And also that self-care, even talking about not only as doctors or the people that we meet on a regular basis. Yes, we can hear all the things that need to change, or you can see your blood results. Everything may look like you are very sick. You may lose hope, but to know, hey, just be compassionate to yourself.
Yes, absolutely.
Coming back to say there is always hope. It may take a little bit longer, but there is always the light at the end of the tunnel. I think that's the message that patients
the hope. Back to the hope. Yes, absolutely. And individualizing every consultation, because we are all so unique, and our response to the environment and everybody's early childhood experience can be completely unique. You know, our genetics are unique. Our everything is unique, and so it's really important to individualize for each patient, because it's not always a one-size-fits-all approach. And that's what makes you know, being a doctor, it's challenging. You know, we have to really resort to a lot of tools in our tool set to truly help people.
Definitely.
Or empower them to help themselves.
Yeah, Jenny, I'm so glad. I mean, this journey of you know, trying to be a good doctors. I like the Thomas Edison, the doctors of the future, and I think the future has come, where we're trying to, of course, impress the patient and how their body works, physiology, and what actually they can actually do, and not always to rely on a quick fix somewhere.
Yes.
That's a journey that we're taking, and hopefully people are starting realizing this. And the small changes we make comes is a big jump with time. And thank you so much for this time. And I really admire your commitment to the patients, and also working in theater. I'm sure you see other side of spectrum of the people that have to be under knife, which could have prevented. But do you see our hospitals, do they offer certain guidance and what patient can actually do, not necessarily always being on the table? What have you seen at the practice where you work?
I think there's slow progress. I think there's still a lot of work that needs to be done. I think there's a place for everything. What I love about lifestyle medicine, that it is foundational health on which we build. And, we can't strive for perfection. So even the hospital settings, I think a lot of hospitals are trying to do the best they can with the resources they have. But there's definitely a big space for patient education and staff education, actually, in the pillars of lifestyle medicine. I would love to see that, really introduced into hospitals, so that patients that are waiting, or even inpatients can have exposure to knowledge about all the different pillars of lifestyle medicine. and having even staff awareness, tutorials, and so there's a lot of progress that can still happen. I'm not seeing a lot of it yet in our local hospitals, but I think there is going to be a slow movement towards that. I'm definitely seeing a building interest in lifestyle medicine. So I think it's people like you who, produce lovely interviews like this to give people hope, and to give our colleagues hope that we truly can help people.
Definitely. Talking about this, I don't know if you can talk a little bit about Salma and what we're busy doing at the moment, and I like what so far Salma have been actually doing. And in fact, I was speaking to many people that I happen to meet now. They know Salma, they know the Facebook page.
Wonderful.
They know the website.
Yes.
And I think that is good a platform that I believe is you're welcoming everyone. And I think there is still many things to do, but what Sam is doing at the moment, and what do you think we can do more?
So I think at the moment we really, our goal is to grow our membership, so that we can really grow the knowledge and awareness of lifestyle medicine. And we're trying to do this a lot through the CPD accredited webinars that we hosting every month, because we all need CPD points, right? It's just something. So it really helps to encourage colleagues to get involved, and to also empower them with proper evidence-based knowledge and science. So that's one big thing that Salma is busy dealing with. We've got a great team. I think without a team, it wouldn't work. We've got a great board and a great executive committee. We definitely are trying to do the patient information booklets. We'd like to improve patient awareness through that avenue. Also being at GP conferences and just networking with other healthcare professionals is something we're doing. So I think there's and our member base is growing slowly.
That's good.
And our goal is one day to host a conference, so that we can really network and grow the interest.
Definitely.
And really stick to it being evidence-based. I think that's what's really important.
I know there are also many other advantages, especially for doctors, and I know of course some doctors also want actually to specialize in lifestyle medicine. I think Salma also does assist somehow.
Yes. So you can definitely go to our website and find the different ways that you can specialize in lifestyle medicine, and all the information is there. So yeah, we really encourage healthcare professionals to increase their knowledge in this foundational healthcare approach.
Of course, yeah.
It's very exciting.
Yeah, definitely. And SAMA is basically South African Lifestyle Medicine Association.
Yes.
Yeah. So
yes.
that, Jen, thank you so much. It's really, I was lovely to meeting you and in person and being able to talk to you. And really admire your passion, lifestyle medicine,
Thank you. And yours.
And also, I mean, I think also the lifestyle medicine, you can actually see in your health. I mean, I don't want to say your age, but you look very young. If you say your age, people probably won't believe, but...
I always say, no, well, you're being very, very kind. Thank you very, very much, Ernest. But yeah, I do want to say that... okay, I'll put it out there. I'm 51, which is the average age for menopause, as I was taught at med school. And
you look younger for that, by the way. Congratulations.
Well, I'm trying, Ernest. Yeah. The self-care part, right? I don't always get it right. None of us are perfect,
of
perfect.
Course, yeah.
But I really do try and, eat a lot of beautiful, diverse whole plant foods.
Yeah.
And I try the daily physical activity and keeping my stress levels in check, and sleep hygiene. So it all starts with our own self-care, that we can go out and be a strong advocate for a healthy lifestyle. It's never too late. That's my other message. It's never too late for anyone to make positive changes. True. That's what I really love. I mean, there's so much more I could share. We could talk for hours.
I know.
Absolute hours. But thank you for
and
your
also
time.
Being here in East London, I'm sure, I mean, hypothetically, in throughout the country, you find that people are learning about lifestyle medicine and they don't know where to find actual lifestyle medicine certified doctors. Where is your practice? How can people get a hold of you actually? Those that are here in East London, or people may...
I practice from home because I love it to be an experience.
Of course.
I've got a vegetable garden, and I actually just consult from my dining room table.
Nice.
And we often walk through my kitchen. My kitchen looks a little bit, I've got, I make my own fermented vegetables, and I've got my instant pot. So I really try and make my consultations practical and empower people with ways how to prepare beans and grains and various spices and everything. And I often consult in my exercise clothes, my walking clothes, to sort of start that conversation about how we can add exercise into their lives, daily lives. Yeah. So I just practice from home. It's very relaxed. It's very collaborative.
Definitely.
And
people can find it. You have maybe a page just for your practice?
I people just contact me on WhatsApp. I do have an Instagram, but this is where I have to. I do give away my age at 51. I've kind of missed the generational gap. I'm not very tech savvy. I'm actually very technologically challenged.
No, it's okay.
And I've really tried with Instagram and Facebook, and I do have an Instagram and Facebook page, but apparently I'm a social media island. I don't post all the time. I've really tried, but
And your Instagram, what is your handle?
It's just Dr. Jen Lifestyle MD.
All right, Dr. Jen Lifestyle MD. Definitely. Yeah. No, thank you so much.
Pleasure.
So lovely to meet you and talking to you. And hopefully we're gonna meet again.
Absolutely, that'll be lovely.
We pray that God keeps you, give you more years to come, and
thank you.
as we educate and empower patients.
Thank you very much for your time too.
Thank you.
Thank you. Lovely meeting you in person.